The VA's fiscal year 2013 budget totals a little over $140 billion, and that's a 10.5% increase over 2012, which is this fiscal year. Well, the $140 billion at the highest level breaks out between mandatory programs, which tend to be our VBA benefits, and our discretionary programs, which 9 out of every $10 in our discretionary programs is in the healthcare system. Those numbers break out $76 billion for mandatory programs, $64 billion for discretionary programs. The 2013 budget for our mandatory programs that totals $76.4 billion will principally go to paying veterans their compensation and pension checks that they've earned to them and their family, as well as paying for the post 9/11 GI Bill and other education benefits, our home loan program, and our life insurance programs. The budget for medical care addresses a variety of priorities, the first being access. It includes $335 million for telehealth, expansion of telehealth across the country in our hospitals and clinics. That means more effective and efficient health care to our veterans, especially the veterans in rural areas. Another aspect of access in the medical care budget is $792 million that will help us open new and renovated facilities through what we traditionally call the activations account. When you look at areas such as mental health and women's veterans care, our mental health budget proposal in 2013 totals $6.2 billion. When you compare that to 4 years ago when the Secretary first came here, that's a 39% increase in our investment in veterans' mental health care programs. For women's veterans' health care, the total in 2013 will amount to about $3.5 billion. And when you look at the component of that that's devoted solely to health care that's related directly to just women's health, that is gender-specific health care, that has increased over the last 4 years by 124%. So again, a significant investment in the health care for women's veterans as well as their access to the system. For the National Cemeteries system, in terms of expanding access to veterans and their families for burial options, there are 3 components in the 2013 budget. The first is land and acquisition funding so that we can move out on the 5 new cemeteries that we committed to build when we rolled out last year's 2012 budget. So get going on those 5 new cemeteries. The second is funding to build 5 new columbaria at different places across the country. And the third component is a new rural cemetery policy, which would allow us to extend the opportunity for veterans to be buried in rural areas. There are 8 new rural areas that we're adding to that policy, and this budget includes the funding to get started on the first 2 of those rural locations. Our information technology budget in the VA for 2013, our request to Congress, is for a little over $3.3 billion. Now that's only about 2.4% of our total $140 billion, but don't let that small percentage fool you. Almost everything we do in the VA, in healthcare and VBA in the cemeteries, could not be done the way the veterans deserve it to be done in the 21st century without information technology. As our leadership team is fond of saying, IT is the lifeblood of the VA. We can't do what we come in every day to do to serve veterans without that investment in information technology. And the benefits of that range from the automation of the post 9/11 GI Bill so we could get those benefits out to veterans in a timely manner, the new e-benefits portal, which gives veterans access electronically to the VA that they've never had before. And looking to the future, in 2013, we expect to have the national deployment of the Veterans Benefits Management System, which is our paperless claims processing environment in the Veterans Benefits Administration, and that is the key component to actually eliminating the claims backlog in 2015.